3:17 in the morning. I pronounced Carlos Ramirez dead. 54 years old. Massive cardiac arrest. 47 minutes of resuscitation. Nothing worked. Chest compressions. Defibrillator. Intravenous epinephrine. The entire advanced cardiac life support protocol. But his heart wouldn't respond. At 3:17 a.m., after 47 minutes of continuous effort, I looked at the monitor showing flatline, looked at my exhausted team, and said the words no doctor wants to say. Time of death, 3:17 a.m. 2 minutes later, at 3:19 a.m., Carlos Ramirez sat up on the gurney, in the morgue preparation room, fully conscious. Asking where he was, "I'm Dr. Michael, and this is the story of the patient who died in my emergency room, was officially pronounced dead, and came back to life 2 minutes later." It wasn't a miracle. It was something science is only beginning to understand, something called Lazarus syndrome. And it taught me that sometimes death isn't as final as we believe. Carlos Ramirez arrived at my Chicago Memorial Hospital emergency room at 2:27 a.m., Saturday, March 11th, 2021. He'd collapsed at home during family dinner. His wife, Anna, called 911 immediately. Paramedics arrived in 6 minutes, found Carlos with no pulse, no breathing, dilated pupils. They started CPR on scene, continued during transport. He arrived at my ER with chest compressions in progress, manual ventilation bag, monitor showing ventricular fibrillation, chaotic rhythm where the heart quivers without pumping blood. His heart wasn't beating, it was vibrating. I took over the code. Continue compressions. Charge defibrillator to 200 joules. Everyone clear. Shock. Carlos's body jerked on the gurney. We checked the monitor. Still, ventricular fibrillation. We resumed compressions immediately. Epinephrine 1 milligram intravenous. 2 minutes of continuous compressions. Charge defibrillator again. 200 joules. Everyone clear. Second shock. We checked the monitor again. Asystole. Completely flat line. Worse than fibrillation. It means the heart stopped trying. We continued. Compressions, ventilation, epinephrine every 3 minutes. Monitor showed flatline. 5 minutes, 10 minutes, 15 minutes. Nurse Lucia looked at me with an expression I knew well. The expression that says we should stop. But Ana Ramirez had just arrived at the hospital, had just seen her husband on that gurney. I couldn't stop yet. 20 minutes, 25, 30. Still flatline. Dr. Patricia Chen, the on-call cardiologist, arrived for consultation. She reviewed the monitor, reviewed the medications we'd administered, looked at me, and slowly shook her head. "Michael, we're at 32 minutes. There's no electrical activity, no response to medications, no signs of life." But I continued. 35 minutes. 40. 45. The team was exhausted. Nurses rotating compressions every 2 minutes because it's physically draining. Arms burning, sweat dripping. And Carlos Ramirez was still dead. At 47 minutes, I knew I had to stop. Not from lack of effort, but because continuing beyond this point was denying reality. His brain had been without oxygen for almost 50 minutes. Even if we could restart his heart now, the brain damage would be catastrophic. I looked at the wall clock. 3:17 a.m. exactly. I looked at my team. Stop compressions. Silence fell over the room. The only sound was the constant tone of the monitor showing flatline. I checked for carotid pulse. Nothing. Pupils fixed and dilated. No breathing. No signs of life. Time of death, 3:17 a.m., March 11th, 2021. I'm sorry. We did everything we could. The team began disconnecting equipment. They removed intravenous lines, turned off the monitor, covered his body with a white sheet. I went to the waiting room to speak with Anna. This is the hardest part of being an emergency room doctor, telling a wife that her husband didn't survive. Anna was sitting with her daughter Sophia, 23 years old, both with red eyes from crying. I sat across from them and gave them the news that would change their lives. We did everything we could. 47 minutes of resuscitation, but his heart didn't respond. I'm so sorry. Carlos passed away at 3:17 this morning. Anna collapsed in tears. Sophia held her. I stayed with them for a few minutes, answering questions, offering what little comfort words can provide. Then I returned to the emergency room to complete the death paperwork. Death certificate, final notes, complete documentation. While I was writing, nursing assistant Ricardo was preparing Carlos's body for transfer to the morgue. Standard protocol. Ricardo had done this hundreds of times. Clean the body, label properly, prepare for transport. At 3:19 a.m., 2 minutes after I'd pronounced death, I heard a scream from the preparation room. I ran there. Ricardo was against the wall, white as paper, shaking, pointing at the gurney. Carlos Ramirez was sitting up, eyes open, looking around confused, fully awake. We transferred Carlos back to the emergency room, reconnected all monitors, started complete evaluation. Electrocardiogram showed recent myocardial infarction but heart beating normally now. Blood work showed elevated cardiac enzymes confirming heart attack, but functionally his heart was working. Emergency brain CT to check for damage from oxygen deprivation. Surprisingly, the scan showed normal activity. No signs of significant hypoxic damage. Neurological exam showed Carlos knew his name, the date, his location. He recognized his wife when Anna entered the room, disbelieving and crying. I pulled Anna aside and explained the unexplainable. Your husband was clinically dead for 2 minutes. I don't know how to explain what happened, but he's alive now. All his vital signs are stable. He appears to be neurologically intact. I left the sentence unfinished because I didn't have the right word. It's a miracle, Anna whispered. I'm not religious, but I didn't have a better explanation in that moment. Maybe, I said. After Anna returned to Carlos, I called Dr. Robert Foster, a senior cardiologist with 40 years of experience. I explained the situation. Long silence on the other end. Robert, are you there? I asked. I'm here, he said finally. Michael, you just described Lazarus syndrome. Lazarus what? I asked. Lazarus syndrome. Auto-resuscitation after failed CPR. It's extremely rare but documented. There are about 60 cases published in worldwide medical literature. Patient pronounced dead after prolonged resuscitation. Minutes later, spontaneously regains pulse and cardiac activity, without any additional intervention. But how? I asked. The prevailing theory involves hyperinflation during CPR, Robert explained. During intense resuscitation, we aggressively ventilate the patient's lungs. CTLY, the question we all had. This can cause what we call auto-PEEP, positive pressure trapped in the chest. This pressure compresses the vena cava, reducing blood return to the heart. It reduces what we call cardiac preload. When we stop CPR and allow the pressure to dissipate, suddenly blood can flow back to the heart more easily. In some rare cases, this sudden pressure change can restart the heart spontaneously, like rebooting a computer. So it wasn't a miracle, I said. It was physics. It was physiology, Robert corrected. But the result is the same. A patient who was dead is now alive. The question is how long it will last. What do you mean? I asked. Michael, Carlos's heart stopped for a reason. Massive infarction. Significant muscle damage. The fact that it restarted doesn't mean the underlying problem is solved. He needs emergency cardiac catheterization. Stents probably. Possibly bypass. And continuous neurological evaluation over the next few days to ensure there's no delayed brain damage. You're right, I said. I'll transfer him to cardiac ICU immediately. One more thing, Michael, Robert said before hanging up. Document everything meticulously. Lazarus syndrome cases are so rare that each one contributes to medical understanding. And, he added with a softer voice, prepare yourself for the possibility that he won't survive the next 24 hours. Many Lazarus patients die again within hours or days. The system was already severely compromised. I understand, I said. Carlos was transferred to cardiac ICU at 5 a.m. We performed cardiac catheterization at 7 a.m. We found complete blockage of the left anterior descending artery, the so-called widowmaker, because the blockage is frequently fatal. We placed 2 stents to open the artery. Procedure successful. Over the next 3 days, I monitored Carlos obsessively, every hour checking his vital signs, cardiac function, neurological status. First day, fully alert. Talking with family, remembering everything except the period from collapse to waking up in the preparation room. Second day, walking the hallway with a physical therapist. Heart functioning steadily with medications. Third day, preparing for hospital discharge. Against all odds, Carlos Ramirez was surviving. Fourth day, we sat down and talked about what he experienced. Carlos, do you remember anything from the time you were, I paused, searching for the right word, dead? He shook his head. I don't remember anything from the chest pain during dinner to waking up in that strange room with that nursing assistant screaming. Nothing in between. No tunnel of light, I asked. No out-of-body experience. Sorry to disappoint you, doctor, he smiled weakly. Just darkness. And then waking up, wondering why everyone looked like they'd seen a ghost. I explained the concept of Lazarus syndrome, hyperinflation during CPR, auto-PEEP, the physics and physiology that probably brought him back. So it wasn't a miracle, he asked. It was science. Depends on how you define miracle, I replied. Medically, it was a rare physiological phenomenon. But the result, that you're alive talking to me now, that feels like a miracle. Carlos was discharged on day 6. Follow-up at 1 month showed cardiac function recovering well. Follow-up at 3 months, he returned to work part-time. Follow-up at 1 year, fully recovered, living normal life with daily cardiac medication. Against all medical odds, the man who died at 3:17 a.m. and came back at 3:19 a.m. was alive, well, and grateful for every day. Today, 3 years later, I still think about that night. I've reviewed the case hundreds of times. Read all 60 published cases of Lazarus syndrome in medical literature. Learned that it's more common than we think, simply underreported. Many cases probably occur and aren't documented due to fear of legal repercussions or professional disbelief. Learned that most Lazarus cases occur between 1 and 10 minutes after stopping CPR. Carlos was a 2-minute case, relatively typical. Learned that the probable mechanism is exactly what Dr. Foster explained, release of thoracic pressure, allowing sudden venous return that restarts the heart. But I learned something more important. I learned that death isn't always the definitive point we believe it to be. There's a gray zone, minutes after pronouncing death, where auto-resuscitation is possible. Not frequent, but possible. This changed my protocol. Now, when I pronounce death after failed CPR, I wait 10 minutes before moving the body. 10 minutes of continued observation. Monitors remain connected. Team stays nearby. Because if Carlos taught me anything, it's that sometimes death isn't the end. Sometimes it's a pause. And in those rare moments, seconds or minutes after we think everything is over, life finds a way back. Not through divine intervention, not through supernatural miracle, but through simple physics. Pressure dissipating, blood flowing, heart restarting, like rebooting a frozen computer. Simple, rare, but real. Carlos Ramirez visits the hospital every year on the anniversary of his death and resurrection, March 11th. He brings cake for the emergency room staff. This year he brought a photo of his newborn granddaughter, a life he almost never knew. A life that exists because his heart decided to beat again, 2 minutes after I thought everything was over. Subscribe, because every week I share cases that remind me medicine isn't an exact science, it's a science of possibilities. And sometimes, possibilities defy everything we believe we know about life and death. Comment below if you've ever experienced something medical that seemed impossible, because these stories need to be told. These lessons need to be learned, so that the next doctor who pronounces death knows to wait, to observe, and to be prepared for the impossible. I'm Dr. Michael, and that night I learned that the difference between life and death is sometimes just 2 minutes. 2 minutes where everything can change, where death can become life, where impossible can become reality. 2 minutes that will change how I practice medicine for the rest of my career.